They say there is no path to happiness, but happiness is the path. On the eve of World Happiness Day, we will we bring to you the episode in which we'll be talking about happiness, and we'll also look at the mental well-being part of it, what the insurance provides us with respect to mental health. We'll discover everything. With For that, we have with us senior psychologist Vedha Chopra with us, and along with her we have Ankur, who is CEO of EXA India Reinsurance branch. So both of our panelists, welcome to the show.
Thank you so much.
Thank you.
Let me begin with the question to psychologist, form of the inquisitiveness of happiness. What is happiness? Be it philosophy, be it religion, everything try to encompass happiness in its own definition. But as a psychologist, how will you define happiness? And so that, please tell our viewers about it.
So, speaking in scientific terms, happiness is an overall sense of emotional well-being. In a narrow sense, we can say that when a good thing happens in our life, we feel happy. However, in a broader sense, we can say the subjective evaluation of a person's life circumstances is positive. So we feel happy. So it can be because of an event, or overall we can feel happy because we are evaluating our life in a more positive manner. But according to me, what I've seen in practice is that happiness is more of a skill, like gratitude. We need to start working on inculcating happiness on a daily basis. It doesn't have to be that when I climb the top of the mountain, I feel happy, or when I achieve a goal, I feel happy. It needs to stop being goal oriented, because then we miss out on all the things that are around us that can make us happy. So, for instance, happiness can come from so many different emotions, like belongingness, love, gratitude, joy, contentment, peace. All of these emotions can give rise to the feeling of happiness. It can be talking to a friend over a call. It can be spending time with your family. It can be spending time with your pet. It can be, just going for a walk and feeling happy. What we all mistake happiness as is that when I reach here, I will be happy. But when you reach there, the basic question that comes in everybody's mind is, what now? What do I do now with this? So instead of making happiness a point that we have to reach, we need to make it a state of well-being that we constantly come back to and practice. And that we can practice through, seeing the good in our lives as we go along the journey, rather than waiting for the destination and feeling happy.
All right. As you rightly mentioned, the thought that if we reach that point and then we'll be happy. I think there is this saying that a gambler is only happy when the dice is rolling, and once, because outcome will come, and no matter the gambler wins or lose, he is unhappy, because that is how the nature of human being is. Going to the point, the youth today, in a way, practices some sort of nihilism, in which they think there isn't any outcome to anything. So that also leads to trying out different stuff, which can be toxicating to the body. What would you say over that, this practice of by the youth?
So, of course, there are people who see meaning in life, and there are people who don't see meaning in terms of what they're doing or what life has to offer. However, if we do have meaning in life, it leads to resilience and happiness. We are more equipped to recover from negative events if we see meaning and purpose in life. However, if we don't, we try to fill that void of meaning, of happiness, of feeling contentment in our daily lives. And then we go jump towards anything that will give us instantaneous pleasure or instant gratification. So we will use drugs, or we will use alcohol, or we will use any other method that would make us happy, like probably overindulge in a particular behavior. Like some people overindulge in, their physique and how they look, or some people overindulge in how much fame they want to gather, or some people overindulge in other activities to make them feel happy consistently. But again, those are instantaneous pleasures. But there is something that is wrong here when we do all of these things, in a extremely consistent fashion. That over time they stop bringing us happiness, because it's momentary pleasure. It's not going to give us long term happiness or long term feeling of well being. When we're not using a substance, or when we're not focusing in that area of our life, or when we're not doing that habit, we'll feel empty, because that is what was filling the void. So sitting with ourselves becomes very, very difficult. And I think my recommendation, or just thought on this would be that, try and not fill the void of meaning, but create meaning in your life as you go along. Find your purpose, find things that make you feel happy, find things that make you feel fulfilled, find things that make your life enriched, without consistently using substances or any other habit that you formed to cope with this meaninglessness.
All all right. As you rightly mentioned, that well-being is definitely a plays a huge role in when it comes to happiness. Uh, Taking things forward, you know, and in a true sense, well-being in a society exists when it's totally okay to say I'm not okay, which brings us to the mental health part of it. So I'd like to bring Mr. Ankur in this conversation about this. Um, when it comes to insurance for mental health, for long period it was not there. Recently IRDAI has mandated that it should be a part of the general insurers should bring in mental health as a part of it. Uh, what would you say over it, and what is your insurance company doing about it?
So mental health has been there out of the insurance. IRDA has been de-emphasizing the public and the insurers to know about it. Sorry, I've lost my voice, so you might not hear it properly. But the thing is, how do you get a claim? What do you define as mental health insurance? In most policies, we only cover inpatient, and the treatment for mental health, unless it becomes quite chronic, it is not inpatient. It is counseling, it is medication, and these things are not covered in most policies. And people don't know this. A lot of people, when they buy insurance, they think everything should be covered. But as an industry, we don't cover that. We cover, I think, very limited coverage has been provided separately for mental health. And there was no demand. Before the pandemic, there was no demand, there was no understanding of the problem also, that it's a real problem. Very honest, for a long time I thought it's something that you new generation kids cry. Till you go yourself through it and you see your team going through it, then you realize it's a serious issue. And it's not a standard coverage you need. It's mental wellness. And then the insurance covers the part of the hospitalization, the medication, the treatment. We as a company became the first one to offer reinsurance support for standalone mental health coverages,
Right.
where we were offering reinsurance up to 80-90% at very cheap prices to insurers to offer to corporates and groups which had an inpatient program plus a counseling part of the program. The only part which we have not cracked the puzzle right now is the chronic part, because mental health for a lot of people is a chronic disease. As an industry, we are not too much into chronic. So what I think is required is that as an industry, we need to add mental wellness as a part of all the products. What we need to understand that the mental well-being has a direct impact on the physical well-being.
Mm.
That is something that understanding is there, but the actual impact on the ground in terms of products is not there. And the corporates have spent something on mental wellness, But we have not seen massive investments even by the corporates in buying mental health cover, mental health services. The way it's in the US, it's not happened yet in India. Also, one reason is that people, it's still a taboo. It's a big taboo. People believe that if they tell they have a mental health problem, how will their HR or how will their boss react? Will it have an impact on its future, on their rating, their bonus, their increments? And so that's a big problem, right? But I am seeing very positive developments coming where there are a lot of individual demands for mental health. And the industry also, with the support of the regulator, are realizing that, okay, we need to do something on mental health wellness. So on the wellness space, mental health has made a lot of progress. On the insurance space, maybe in the next 6 months, 1 year, you will see a lot of products being issued. And we as a reinsurer, there to support insurance companies in this journey. Because if they feel it's a risky product, it could be loss making. So we are happy to provide capacity for them. And
All right.
it's an evolving process. And even in Ayushman Bharat, the government has mentioned they would like to cover mental health. But you can say you're covering something without specifying what you're covering.
Hmm.
Then as I said, mental health alone cannot work. The mental health helpline needs to work. So we, along with Veda, we tried to run a mental health helpline for a long time to see how people react, which generation calls, which generation does not call, what are the issues. So we still find that people are not willing to come out in the open. The younger generation is still coming. The people around 40 and 45, 50, who are going through midlife crisis, going through career stress, they are not coming on the mental health helplines also. That's the problem.
All right. Uh, as you rightly mentioned, Ankur, that um, the expenses when it comes to psychological disorder, it is very exorbitantly high. And uh, so in that scenario, if we compare um, insurance for mental health to the physical health insurance, will the premium be much higher in case of mental health?
For a standalone cover, no, because insurance is also about probability of how many people will actually use it. If you look on the group side, because there's no anti-selection, the entire group is covered. There, the premium might be low. But on the retail side, the premium could be very high, or because only those people might go for the cover who are actually going to use it.
Um, uh, and when it comes to health insurance, tell us about the parameters as a consumer I should be aware of. Uh, what should I look for in a health insurance?
I think first you need to see what is the sum insured you require, basic sum insured, and maybe a lot of people earlier used to go for 2 lakh. Today, what you have to take into mind that the health cost everywhere has increased. So
Hmm.
minimum you should have a 5 lakh cover. Then do you have a family history of a particular
Is this
illness?
is this for rural India or for urban India? 5 lakh cover.
Right, rural India already has that coverage through Ayushman Bharat.
Yes. Yes.
It's a family four-floater, but I'm saying more from urban and a semi-urban.
Okay.
Talking about people who do not have subsidies.
Missing middle.
So you look on the 5 lakh cover, then you see if you have a family history of a critical illness like a cancer or a heart and other parts, where you think this could come and hit you, then
Hmm.
you take a top-up cover for only that illness.
Okay.
What is very important to understand is what is the copay? What is the amount you have to pay in every treatment when you're admitted? What are the room capping charges? Are you allowed a single room? Are you allowed a general ward? And what is the deductible? So a lot of people don't see these things. And when the insurance company cuts the claim, they realize that, oh, why we have not been paid.
All right.
Also, what is important to see if your insurance company is offering you wellness things like telemedicine or some other therapy or other things as a freebie or something which is helping you monitor your health. And can you also get a product where if you're able to improve your health parameters, you can have a lower premium reduction. So something that over in the long run can fit with your lifestyle.
All right. All right. So when it comes to the claim settlement, as you were saying, that many people are unaware of the basic parameters like what is the cap on coverage and copay, everything that you have mentioned. So what is the claim settlement ratio when it comes to XI insurance?
We are a reinsurance company, so we do not directly settle claims.
Okay.
Our insurance settle the claims, so we pay them to them. So I would not have those figures, but if I go by their figures, some show 95, 98, 98. But what is settlement? What you want to know is not settlement. You want to know that if you put a claim, is it paid? Settlement could be that you claimed 100, I paid 50, it's settled. You claimed 100, I rejected, it's settled. So that's not the right parameter to it.
Okay.
So I honestly feel that data when we call to settlement is a little misleading. What is required is the turnaround time and what is the consumer satisfaction index. But mostly you will find is that insurance companies nowadays are pretty prompt in offering you cashless facilities in hospitals. You still have delay in reimbursement, but on the cashless part, it's pretty good. I think India today may be the best in the world right now.
All right. All right. So when it comes to the pre-existing conditions, and even with respect to the mental health condition, if a person is already having some mental health issues, will it be able to avail the insurance part of it?
Or not on the retail. On the corporate side, yes. On the corporate side, because we take a group, so pre-existing is covered. On Ayushman Bharat, pre-existing is covered, but the retail customer won't be able to get it.
All right. So I'll come back to Vedha, to you. And so as we were talking about the happiness part of it, and you also mentioned that people gets obsessed by it, by the goals that they set. So can we generalize happiness as a scam in a way? Because then although this is on the eve of World Happiness Day, but can we in a way say that it is a scam, and then people get chase it like anything, and then even people go to different spiritual gurus and other wellness centers, which take a lot out of their pocket, and do they really serve the purpose? So what would you say over happiness as a scam?
I don't think happiness is a scam. I think if you see happiness only in terms of goal achievement, then it loses its flavor and it loses its importance and value in somebody's life. Happiness is added in your life to make it more enriched, to inculcate positive emotions, to feel good every day. If we see happiness in terms of a skill that we practice every day, coming back to the same state of emotional well-being, experiencing gratitude or experiencing belongingness or joy, I don't think it would be a scam. I think that would be the ideal way. Of course there'll be days that you won't feel happy. Of course there'll be days where happiness would be extremely difficult to get back to, but I think it is achievable in terms of practicing, in terms of daily routine, finding little joys, little pleasures in your daily routine, and how it makes you feel. So personally, like if I have a great session with a client and they're doing well, I feel happy. Or if I'm spending time with my family and everybody is cracking jokes or talking about upcoming events and feeling excited, I feel happy. And that's where we need to start evaluating happiness from our day to day, rather than, okay, let me get on top of this mountain, let me get this promotion, let me become this size, let me become this famous, I want these many followers, and only then I will be happy. So this only then I will be happy needs to change to, I am happy right now because something really nice happened today. This mindset and perspective shift needs to happen, and then happiness will probably stop being a scam.
All right. Um, Let me just put forward one more question, although this is not from your uh, genre, I can say. But Ankur, if you have to address that the quality such as compassion, happiness in a corporate world, and that too in a leadership role, the characteristics like assertiveness and competitiveness, these are really valued. And so do you think as a leader somewhere you have to compromise the compassion part of it, because there it's not like you are doing it, but because of the system, because of the competitiveness, capitalism.
See, I honestly believe compassion doesn't need to be compromised, but that depends on leadership style. Some people believe being compassionate means being, how to say, weak. But I think being
Valuable.
compassionate is not a bad quality at all. It just makes things better. It makes you trust people. Yeah, they can betray again, but again, it's not bad to trust people. Second, that's the closest you can get to happiness over a period of time, to compassion. And then when you go to an office and you're in an organization, you like the environment out there, that then you work. If you don't like the environment, then you find 100 reasons not to go. So I feel that assertiveness, aggressiveness, all those things are good qualities to have when you're dealing with targets and goals. But as an organization, when you're interacting with each other, I think you don't need to be aggressive, and that being compassionate is a better thing.
All right. Ankur, when it comes to outpatient care, as you were talking about, be it in the case of mental health, or even I was reading something with respect to teleconsultancy that you have written. Uh, Tell us the how important is it to inculcate OPD, in insurance policies, uh, so that the patient can avail the best benefit of it.
I think OPD is very, very important because India, we have a culture that all of us are doctors, including myself. You can see what I've done to my own throat. So the thing is that we are so used to getting medicines OTC that we do treatments on our own. And the primary care part is, I think, whenever things are bad, why you need to show to a doctor, you need to address to a doctor. But reaching out to a doctor is not easy. Taking appointment, going. So that's where telemedicine comes very nicely. It comes and it can be cost effective. Whenever you want, you should be able to check. Then on the OPD part, today what happens is that we do not even count the amount we spend on the OPD. All of us would be slowly, but in a year spending around 20,000-25,000. 100 rupees medicine, 150, this, that test. But imagine that if we had a coverage of say 20,000 and we were paying 4,000 or 5,000 rupees for it. And then the insurer is looking to ensure that you don't take that claim. So he's bothered about your wellness. You would like to know that you're well. Today, in such a fast lifestyle, we are not bothered too much about our wellness. We are looking for treatment rather than seeing how things go. So what I believe is if OPD is as coverage out there, first we'll be able to monitor our health better. We'll have insurers looking to monitor our health because they don't want the claim ratio to be high. Third, what insurance does, it gives you benefit of pooling. So if insurance has a hospital network, you get discounted treatments in your cashless policies. Same, when you have primary care treatments like diagnostic chains, pharmacies, you will get the advantage of getting a cheaper diagnostic test. Maybe a blood test which costs you 200 rupees, via insurance might just cost you 140, 30. So that advantage will come to you. And once people start seeing that advantage, I think OPD will be a norm. OPD will be a norm. And telemedicine is the first key part to it. I honestly think telemedicine should be free. Generic telemedicine should be free of all policies, inpatient, outpatient. Because today what happens is you only tell me you're ill when you're in the hospital. I can't do anything. Imagine that when you're not well, you call me at least I can see if I can guide you properly.
All right.
So I think telemedicine is something that government should make it a norm, or the regulator, that should be compulsory, at least minimum telemedicine in all policies.
Hmm. All right. So as you said, that the preventive healthcare part can also be, given impetus if we go with the free tele consultancy. Uh, Having said so, any message that you would like to give our viewers with respect to, mental insurance, or what they should look for, what should their anticipations be, Ankur?
So first, mental health coverage is available. You should ask your insurer about it. Um, on the corporate side, yes, it's much more available. But if you don't, you should not be afraid of thinking that you have a mental illness. First, you think a mental illness, then only you will look for a coverage. And going forward, I believe in the next 6 months to 1 year, you will have a lot of companies adding mental health and mental wellness as an option. So if you do not see a mental health insurance product, start with a mental wellness product. That is virtually available all across the platform. So, but understand it's not a, it can be a chronic problem if you do not solve it now.
Okay.
So address the problem, because if you just ignore it and you think I don't want to spend money on this cover, I don't want to do money on mental wellness. The problem is you will have some physical illness due to that mental problem, and then your premiums will go up.
Hmm.
So take that into mind, that your mind will decide everything for you. That's more important than the physical symptom.
Okay. And as you rightly mentioned, that we need to acknowledge if there is something wrong, irrespective of the stigmas associated with it. Otherwise,
The
it will be like.
funda in life is 97% of the people don't know you. So if they get to know you and you have a mental illness, how does it matter? 1% are close family friends to you. So they will be happy if you come in. 1% hate you. But doesn't matter. For this is 1% people who just might be your work colleagues and others. Why would you damage your own health?
True.
99% of the world doesn't care if you have mental health or not. So think of yourself and be very open on it.
Veda, if you would like to say something over the mental health part of.
I think what Ankur sir has said is completely right. You need to start taking care of your mental health, and break through the walls of stigma, because that's extremely essential. Mental health has a direct impact on your physical health and also functionality, everyday functionality. The ability to do everyday tasks reduces, and we're not efficient enough. We can't maintain our relationships well. We find it difficult to get up and get the day going and get out of bed. So it's extremely important to start taking care of our mental health now, whether it's through an insurance product or whether it's through any other channel. Like when we started the helpline, we thought that a lot of people will access because there's confidentiality. You're not coming for an in-person session, so nobody is seeing you. But even then, people were so hesitant to come forward and seek and avail mental health services that it was quite disappointing for us. And if you look at the stats in India, 1 in 4 people, are suffering through some or the other mental health concern. And we have actually very less number of mental health professionals currently in India, like probably just 9,000 psychiatrists, 2,000 psychiatric nurses, and 1,000 clinical psychologists for all of India, which is extremely less. So if people are getting mental health services and access to those mental health services, please take it. And early intervention is the best cure, so that nothing turns chronic and nothing turns severe.
All right.
See, a lot of people are not realizing one thing. You have a major problem of substance abuse. You see in Punjab and other places, that comes due to stress. Even in Ayushman Bharat, the idea of putting mental health is that in a lot of parts in the country, there are disturbances. Due to those disturbances, there is stress and people are going for substance abuse. So will mental health coverage give them a chance to get treatment? But we only give them treatment when they get hospitalized.
Hmm.
The prevention part and the part when they need therapy before they go to the medication, that is the part which is missing right now, which needs to be addressed.
Hmm. And as far as I know, Ankur, the retarded mental health, which is like if you do substance abuse or alcohol abuse, it is not covered in the part of mental health insurance, I think.
No, it's not mental health, but imagine that you've done a substance abuse and you're hospitalized,
Hmm.
then that is covered.
Oh.
Hospitalization is covered. But if it's a chronic treatment and you're a drug abuser, you will not get an insurance policies.
Hmm.
You will have no coverage.
All right.
The
So,
insurance is for uncertainty. Insurance is for uncertainty. So
okay.
if it's a certainty, then the
Hmm.
probability
It,
is very low of getting
it
a
need
coverage.
not be deliberate. Yeah. Okay. Okay. Um, so, uh, Veda, let me be the devil's advocate here and uh, ask you. Although this is a little different from the topic, but uh, today we see that people take everything very seriously. Although it is said that mental health should be taken seriously, but and as I said, I am being a devil's advocate here. That if um, I expect somebody else to, uh, have a thick skin, don't have a thin skin, and because this is the freedom of speech debate everywhere. That if I say something, then it is my freedom of speech, and the other person's the parameter of him or her or they being sensitive is unknown to me. So what would you say over that when somebody tries to when it comes to mental health, somebody tries to propose that I'm having my freedom of speech, I can say whatever? What would you say on that?
I would say that yes, you have freedom of speech, but sometimes words can hurt a lot. And specifically when somebody is going through something severe or somebody is undergoing trauma. So you never know what the other person's journey is like. And sometimes using harsh words can push a person to the brink of a mental health disorder, stress, re traumatization, anything else. So many times, I've seen pseudo therapists, people who are wellness coaches, people who are, gurus or wellness gurus. And a lot of my clients have gone to them, in
Mm,
fact. And sometimes they have said things that have re traumatized the clients. So be careful about what you say and what you preach, and of course, study and be trained and be qualified and be licensed before you start practicing and working with clients who have a history of trauma. And for other people, try and be empathetic because you never know what the other person is going through. So yeah, freedom of speech is there, but even freedom of living is there, right? And freedom to choose is there, but we don't go around choosing to hit people, or we don't go around choosing to cause harm to other people physically. Then why do that emotionally? We
mm,
have laws for physical violence, but we don't have laws for emotional violence. Doesn't mean we have to use it, doesn't
mm,
mean we have to perpetrate that kind of violence.
mm. So I think the crux is that if you are empathetic, you will understand the other person is being affected, and automatically you will restrict yourself from saying anything wrong. Thank you so much, both of my panelists, for being with us, and it was a pleasure talking to you both. And thank you so much. And as you said, that I think after this conversation, our viewers will be mindful of when it comes to mental health or the insurance part of it, or understanding the mind, the happiness concept and the different notions that comes with it. I think we have been able to address this in this episode. Thank you so much for being with me. Thank you so much.
Thank you, Bhupendra.
Thank you.